Well, hello, everyone, and happy Wednesday to you. This is Joan Pugh from First Financial Federal Credit Union, welcoming you to our Wellness First Wednesday session today. We're so glad to have you with us, and we know that you're going to enjoy this presentation and really learn a lot. That's what I'm really looking forward to. So today's session is called Acupuncture, Yoga, Meditation, and Nutrition Can Support Your Health. So with no further ado, I'd like to introduce you to our presenter today. We're so pleased and honored to have Dr. Carla Johnston with us to share today. So Dr. Johnston is a licensed and board certified nutritionist in Maryland who recently completed her doctorate in clinical nutrition. She currently holds an MS in herbal medicine from the Maryland University of Integrative Health, along with an MA in applied sociology from the University of Maryland, Baltimore County, where she focused on the impact of chronic illness on aging adults. She's the manager of community outreach and partnership at Maryland University of Integrative Health and a clinical practitioner focused on nutrition. Carla, welcome and thank you for being with us today.
Thank you so much. It's great to be here.
So with no further ado, Carla, I'm going to say go ahead and begin the presentation. Thank you.
Excellent. Well, thank you. Good afternoon, everyone. Thanks for joining me today with this information. Next slide, please. So we're going to have an introduction into some complementary health practices. And I say an introduction because each one of these in the presentation literally could take an hour on its own. So the purpose of this is really to introduce them and for you to decide if these are worthy of further exploration or perhaps having a deeper conversation with someone who is practicing and learning what each of these modalities can provide for supporting your own health or perhaps the health of a loved one. So complementary health, I still hear the term CAM used, and CAM really, I would say, is not as contemporary a way to think of complementary health. So CAM was complementary and alternative medicine. And so back in the day, it was really thought that if you chose CAM, that it was away from your conventional medicine. Meaning, instead of going to my doctor, I may go see another practitioner. With complementary, it really is incorporating this health provider into your current team. So you may have a medical doctor, for example, someone may have a cardiologist, they may have a acupuncturist, and they may also be working with a naturopathic doctor. So it's just a way of thinking of how this team, I call it your healthcare team, is put together, all with the goal of supporting you in your health. And today, for this presentation, we're going to be talking about acupuncture, massage therapy, nutrition, and yoga therapy. I starred nutrition because in transparency, I am a nutritionist, so that's the viewpoint that I see things. However, with my role at Maryland University of Integrative Health with community outreach, I often talk about these other modalities that are available in our clinic, and I'll be talking about that at the end. Next slide, please. So why is it important to know the science of health? And with the National Center for Complementary and Integrative Health, what they say is that there's a lot of misinformation out there, and research enables us to make this informed decision about our health. Many of the modalities that we are going to talk about have traditional origins in many cultures all over the world for many thousands of years. And with contemporary science, what is happening is that research is confirming what the belief was of how these support health. And through these contemporary evidence-based research analyses, we have discovered that they're supporting health in the same way medical doctors do, medical staff do. And so that is why the shift from alternative practitioner to complementary, because everyone does agree that this brings value, this brings healing and health in addition to all of the other healthcare practitioners. So as we go through, when I talk about each of the modalities, we're going to talk a little bit about the tradition, and then I'm going to show you where the science and the research has shown us that there has been provable benefits, if you will. Next slide, please. So with acupuncture, acupuncture has been around for over 5,000 years. And if we think about that, That's a really long time. So it has a rich tradition. And what is also fascinating to me, at least personally, is that 1/3 of the world uses acupuncture as their primary healthcare system. So here in the United States, we use it as complementary. However, there are other parts of the world where this is the primary use for their healthcare. Now, acupuncture, most people will initially think of the needles. I'm afraid of needles. And it goes beyond that. Acupuncture is a way to move energy within the body and allow the body the ability to heal itself through the practitioner's points that they're using with the needles, where they're being placed, and possibly how many needles there are. So it is a tradition of allowing the body to heal itself to the best of its ability with the addition of acupuncture needles. Many acupuncturists also have Chinese herbs, so it will be a synergistic relationship between use of the needle, the body's ability to heal, and then adding Chinese herbs to that treatment plan. Now, there are many, many, many research journal articles out there talking about the success of acupuncture. And with research articles and clinical research, the focus typically is on a disease state or a condition, such as anxiety and depression, hypertension. We have well-documented evidence of acute and chronic pain relief, and cancer care. And so what this allows us to do is say, okay, we've got this 5,000-year tradition of using this. We have all of this anecdotal evidence. And now the science is confirming that, yes, acupuncture indeed for these conditions and many others, I literally could fill a slide, many others where this has shown to be beneficial. I would also like to point out here that acupuncture and all of these modalities that we're going to talk about, while they support a health condition or a disease state for sure, they also support overall health and wellness. So if I want to continue to feel well, I may add acupuncture as a way of providing self-care to myself to maintain that balance, to allow myself the ability to stay energized and to stay resilient. So it is not always necessary for someone to seek out these modalities if they aren't feeling health or wellness, or if they are. So they support in each case. Next slide, please. So massage therapy, when I talk about massage therapy, many people will think of a spa, you know, with the warm rocks going down the back, or they will think about, you know, the water flowing, the waterfall in the spa. And that's certainly one way to think about massage therapy. With our natural care center at the university, we're looking more at the therapeutic or the medical massage. And so this is where the massage therapist will work with someone based on their underlying conditions. Perhaps there is an injury, or there's chronic pain or acute pain, and overall chronic stress relief can also be used as massage therapy. So yes, it supports relaxation. However, it's really more focused on the practitioner's ability to measure physical healing in time over massage therapy. There are research articles to confirm the benefit, and the two that I've listed here are osteoarthritis and the relief of cancer pain. And that is called lymphatic drainage massage. And this is someone who has specific knowledge about how to work through a body that is currently going through or has experienced radiation and chemotherapy for the treatment of cancer. And so again, this can support if you have an illness or you have pain. For example, if I have back pain, or perhaps I have excessive pain in my neck and shoulders. Frankly, that's where I keep all of my stress, so I know when I'm stressed. And so I may see a massage therapist on a regular basis, again, as part of my healthcare team and part of self-care, so that I can continue feeling well in addition to these other disease or illness states where you may find this to be helpful. Next slide, please. So nutrition, we know food is medicine. That's a quote that's been around for thousands of years as well. And although intellectually, I think many of us know that food supports our health, what isn't always known is which foods can create symptoms that are not supporting the body's overall health. And so the first that comes to mind is many people will say they have a food allergy. They may even have a food sensitivity to a particular food. And over time, that sensitivity can create its own symptoms that lead to another health condition. So integrative nutritionists will look at each person individually, as these other modalities do, and see what actually will support one's health. As a nutritionist, I'm often asked, even with my family and friends, what do you think about this diet? Or pardon me, I've heard the keto diet is the way to go. Or, I've heard that the paleo diet is the way to go. And my answer always is that individualized nutrition is the key to health. So everyone on this call, I can almost guarantee if we were to write a list down of our genetic dispositions for diseases that we might have in our family, our likes and dislikes, our stress levels, our sleep, how we move, all of that would be different. And so that is where an integrative nutritionist would be working with each person individually on those, and then incorporating what could be shifted to attain what those goals would be. Now, there is research, and I put lifestyle after the Mediterranean diet. One of the most researched diets out there right now is the Mediterranean diet, which is really more of a lifestyle. And I say that because it's looking at whole foods, lots of color with antioxidants, fruits and vegetables. There is animal proteins on the Mediterranean diet, so it's not a vegan diet. It has lots of plants. It has a variety of beans, nuts, and seeds. So it has a wide ranging, it's very diverse, very colorful diet. And what the research has shown is that those that follow that lifestyle, it can positively provide benefits for those with hypertension, metabolic syndrome, which is supporting all of our cardiovascular functions, cancer, even brain health. We know there's a significant relationship between our gut and brain. And so when we take care of the gut, we allow the body to take care of the gut, we certainly can positively impact the brain. Next slide, please. And so yoga therapy, I like to talk about briefly because a lot of people aren't aware that it even exists. And yoga therapists use tools and practices that empower you as the participant to improve your health and well-being through breathing and through postures, meditation, and then some lifestyle shifts. So a yoga therapist is different than a yoga teacher. So a yoga teacher would have a class full of folks taking yoga, and then a yoga therapist, it's a one-on-one practice. Now, there might be some yoga therapists that also have classes, so there might be some overlapping there. It is a one-on-one practice working with you, again, as an example, with someone that I knew who had a family member who recently had a stroke and had difficulty moving. They had lost some resilience, and frankly, they were in a low place. I mean, to go from a very active lifestyle and then not be able to move so well, that can really impact someone's state of mind. And so working one-on-one with a yoga therapist, they were able to move their upper body, to gain some strength in their upper body, and then gain some confidence of what they were able to do instead of that constant reminder of what they were no longer able to do. And they did this through meditation and some skills that they had learned, and then also breathing, and then the posturing. So that is just one example that I personally know of, and there are so many others. I literally could fill a whole presentation on each one of these, as I mentioned earlier. Yoga therapy is a relatively new profession. There is research out there right now for osteoarthritis and SLE, which is systemic lupus erythematosus, which I'm hoping I'm pronouncing that correctly. And again, this would be someone who could be added to your team if you had a particular ailment or condition that you needed support on, or this is something that I want to do to build up my resiliency, to build up my ability to build strength. And so it's just a lovely practice of bringing in movement and also breathing and lifestyle shifts. Next slide, please. So what are the takeaway points here with these brief introductions to these modalities? The first is that each of us is individual and that each of these practitioners have the ability to work one-on-one and make it personalized. As I mentioned earlier, each of us would come to the table with a specific list of what makes us us, and so making shifts to be impactful would need to address those. And then also, we want to support our overall health through these practices in addition to supporting illness and disease. Many times I'll have conversations in community with someone who says, you know, I'm feeling pretty good, but I don't know if any of these would support my current health. And so having those conversations could bring awareness to where additional self-care could take place. I'm not sure about you on the call here. However, I can tell you over the past couple months, I've experienced a little bit more stress in my life, lots of uncertainty. And so each of these practices can also help us to adapt and become confident in how we're moving forward and how we get support with our life and health and wellness, in addition to, and if we are experiencing a disease state or condition. I also want to point out that research is continuing. So the research is showing and has shown that all of these provide health benefits for those that enjoy it. And it continues. So all of these traditional medicine practices that are being reviewed are allowing all of the medical care community to see that it may not just be one size fits all or one medical practitioner on a team. Now we're starting to see these integrative teams where we have different practitioners coming from different viewpoints and including mental and emotional support, which we don't have at our clinic. However, they are certainly becoming part of our healthcare teams. And since we were talking about this shifting in the conventional medicine, I thought it might be interesting to mention that Maryland University of Integrative Health in our Natural Care Center, we have some collaborations with conventional medicine treatment areas. So the first would be Howard County General Hospital. So our students in the yoga therapy program actually had a practice day and time over at the hospital to go onto the unit to work with patients. Now, this was discontinued due to the pandemic. However, when this was in place, the patients reaped immense benefits from it. And anecdotally, what was shared to me is that even the nurses on the nursing units, once the students arrived, the whole atmosphere took on a less harried cadence to it. Things became more quiet, and even the nurses found the benefit for the yoga therapy students to be on the unit working with the patients. So it was just a lovely reminder of the power of having these type of practitioners working one-on-one with folks. And then also we have, when we talk about cancer, the Claudia Maratina Broccolino Cancer Resource Center that is on the campus of Howard County General Hospital, we now have a collaboration where an acupuncturist, a nutritionist, and a massage therapist are actually over at the Cancer Resource Center seeing patients. So these patients may be they may have just received the diagnosis of cancer. They may be in the middle of receiving cancer treatment, or they may be post-treatment and working on survivorship. And what's lovely is that all of these modalities the hospital has deemed to be beneficial for these patients, so they have the ability to add these practitioners to their healthcare team, to their oncologist and the radiologist and their conventional medical team. And there is collaboration and synergy between the practitioners at the Cancer Resource Center and the hospital. So again, this is just the shift that is taking place and moving away from alternative, because it really is becoming part of the healthcare system. Next slide, please. So I always like to say this, that you are the expert in you. So when you are working with a healthcare practitioner, you are bringing in what your vision is for your health, what you're able to shift and where you find challenges with shifting, your previous history. Perhaps you've tried something in the past and it worked out really well, or perhaps it didn't. You also are the expert in what you feel called to do. So for example, if I have back pain, I may not be clear if I want to start with a massage therapist, or perhaps I would like to go see an acupuncturist. Maybe a yoga therapist would be helpful. So this is where having these conversations with all of this information, you get to decide what you feel like would best serve you and what your goals are. And this is where the team can take your questions and help you to decide that for yourself. Next slide, please. So I want to talk a little bit about the Natural Care Center. I know I had mentioned it in the beginning. So at Maryland University of Integrative Health, we have a clinic. We call that the Natural Care Center, and it's been in the Howard County, Maryland community for over 40 years. And I like to say we have two wings of the clinic. So on one wing of the clinic, we have a faculty supervised student clinic. These are students that have gone through their classwork and are now transitioning into becoming clinical practitioners under the supervision and guidance of faculty members. And so if someone were to come in and request acupuncturist on the student side of the clinic, they would be seeing a student, perhaps an observer, in addition, another student observer, and then they would also have the benefit and have the guidance of a faculty member. On the other side of the clinic, we call that the private practices. So these are private care practitioners who are already licensed in their field. Many have been in the field for over 20 years, and they practice also at the Natural Care Center for that one-on-one. And if someone were looking for perhaps a practitioner that was experienced in a certain modality. For example, if someone, and I had this question last week, someone had asked me about their child who was experiencing severe anxiety, and would acupuncture be beneficial there? We actually have an acupuncturist on the private care side where that happens to be a specialty of his. And so we put them in touch together to have a brief conversation to see if that was going to be a good way for this person to go. So again, we have the private care side with one-on-one, where you're going to see the same practitioner over and over. And then the student care side, where the students would be rounding through as they work their way through the academic programs. Next slide, please. Now, many times, and myself included, after this presentation, we'll say, well, I have this condition and I have no idea where to go. I am interested in this. I'm not sure about that. So what would be the next step for me? What we like to say, if you're not sure, to please give us a call. Our front desk does an amazing job of talking about what's available, and with some key questions can help you decide which fits better. And what do I mean by that? So we have people that will call the front desk and say, I'm not sure if I want to see a student practitioner, or I'm not sure if I want to see a private care practitioner, or would it be better for me to see an acupuncturist or perhaps a yoga therapist? And so with some key pointed questions about what you're looking for and what your health goals are, they can give you some options, and then you can make the choice there. So essentially what I'm saying is that we're here to help, even if you're not even sure how to move forward. All of this is available right here in the area. And so I put the contact information for the clinic and also the phone number and the email. Now, I want to take a minute really quickly to talk about telehealth. So when everything shut down over this past year, we did move out of the natural care center. As a matter of fact, our whole building was closed. And we are now back in the natural care center. So we do have practitioners that are seeing folks in person with all of the COVID restrictions. We also still have telehealth available for those that are not feeling comfortable enough to meet in person. There are telehealth appointments that are available. And again, all of that information can be given to you on the website, or if you call and have a specific question, please don't hesitate to reach out to us because we can answer any of those questions as well. Next slide, please. And so this is my direct contact information. If someone has a question, what I find in group settings is sometimes people don't feel comfortable asking. And then when they think about it, or they might have a conversation with a loved one or a family member and have an additional question and don't want to call the front desk, I always provide my contact information because you might have a quick question for me if I can help, or if I can put you in the right direction, I'm happy to do so. So if you're like me, you're going to listen to all this and it's going to be great. And then you're going to walk away and the next day you're going to go, now, what did she say about this? I can't remember. And so I always like to provide my contact information so that I can answer those questions as well. Next slide, please. And so these are the articles that I pulled. If someone wanted to take a look at the actual articles and enjoys reading clinical research, I wanted to make sure that I had that in there as well. And then what I'd like to do now is to open it up for questions. This is enough information that I'm hoping will spur some questions or some interest or something that I can answer for you. So I will open it up for questions.
Oh, Carla, this is great. I feel like we have gotten so much information. You can hear me, Carla?
I can, yes.
Awesome. Okay. This is Joan Pugh again from the Credit Union. And we do have some questions for you.
Sure.
Again, you gave us so much information. I'm going to share with the group that I did put the contact information that you provided there in the chat. You can also reach out to us here at the Credit Union. I'll put my own email if someone who's participating wants a list of your references for articles too, since you shared that. So let's go to our first question. Our first question was asked, can acupuncture help with weight loss, struggles, and arthritis?
Yeah, so what I would say is what acupuncture is going to be able to do, the quick and short answer is yes. So what you'll learn about me is I say yes, and then give a little bit of explanation after that. So anytime we need to shift our weight, typically there can be some other underlying conditions that when we focus on and bring healing to will result in our body's ability to lose some weight. Certainly arthritis, any type of pain condition, acupuncture could certainly support that. So my short answer is yes, with a little bit of an explanation of how that would work. And so what you would do is when you work with your acupuncturist, you will both come up with a treatment plan to support your healing in both of those. Great question. Thank you.
Thank you. Here's another good one. Where might someone outside the Maryland area look for resources? And what type of licensing should we be looking for?
That's a great question as well. So acupuncture is licensed nationally. So in order to be a practitioner in acupuncture, you must hold a license. So if you are looking at that modality, you would want to take a look at the licensure to make sure that someone's licensed. With nutrition, there are two routes for nutrition. One is a dietitian, which is a national certification, and the other is nutritionist. And many states require licensure. Maryland happens to be one of them. You must be licensed. With all of our licenses, additional CEUs or continuing education is required for you to renew your license. So there's always education there. Same with massage therapy. With yoga therapy, there isn't a license for that at this point. What I would say is when you're doing your research and you might get a referral, or perhaps you have a name of someone that you're interested in, I always really recommend that someone take a look at what their credentials are. Now, I believe, this is Carla speaking, that many people have lots of credentials. I look at credentials and experience. So for example, with herbal medicine, although I received my degree in herbal medicine, I have worked with and continue to work with herbalists that don't have an academic degree. They grew up with herbs. They have their entire family history in herbs, and they are immersed in herbal medicine. And so I wouldn't pick someone with an academic degree over that other person, and you will get to know that through doing your due diligence and research. So that is such a great question. I always recommend look at their credentials, look at their experience, look at who their target market is with treatment. Sometimes people specialize and will feel comfortable working with someone who specializes. Others may not be so concerned about the specialty and just want to work with someone that they feel like they've resonated with. The other is to ask for referrals. Even if you know of, it's not uncommon for people to say to me, you know, I'm moving to, this just happened recently where someone said, I'm moving to South Carolina and I have no idea how to start doing research. I want to work with someone in South Carolina. And so we talked about what they might be able to do that. Many health websites and credentialing websites will have those listed. And then if there's something that we can do to help at the Natural Care Center, we have a very broad base of alumni from our university from all over the country. As a matter of fact, in my class, my doctoral class, we had an international group of students. So Maryland University has a wonderful breadth of alumni that we might be able to put you in touch with someone who's graduated from the university, has been practicing, and are not located physically in Maryland. Did that answer your question?
So I'm going to ask the person who asked that question, if they want to follow up with another question, just go ahead and put that in the chat. What I'm hearing you say is that you certainly could reach out to Maryland University to get some resources in another state. That might be a place to start.
Yes, and we often will receive phone calls with, sometimes what will happen is someone will say, well, I worked with, a student who has graduated and I wasn't sure where they were, or like I said, I'm moving out of the area and I'd love to work with another practitioner. Do you have someone that you might be able to recommend in another state? And we have a alumni directory that we might be able to help them with. Yep.
Great. And the person did reach out and said that you answered the question.
Oh, excellent.
And he or she appreciates it. So here's another question. Are there any books or other reading materials that you would recommend regarding herbal medicine to use for certain concerns?
There are some great books out there. I know a couple that I've recommended. Rosemary Gladstar has some wonderful books. Many of the nutritionists that are out there also have experience with herbs. You could do a cursory search on herbal medicine and then look at the authors. Again, with books, as a practitioner, when I personally look for a book, I look at the author. Are they writing the book to provide the information, or are they writing the book to provide a way for you to work specifically with them or their specific brand of something? For example, there are some authors out there who are writing books about herbal medicine that are aligned with a supplement or an herbal remedy that they themselves have put together. Now, is there anything wrong with that? Absolutely not. However, if you're looking for more of a generalized herbal medicine book, then you would have to dig a little deeper. So what I would say is do a cursory search, kind of take a look at some of those authors, and then see what you resonate with. Don't underestimate the power of what has sparked your interest. And many times, just through my own research, something will pique my interest and I'll go over and start reading it, and it will lead to something else, and it will lead to something else, which all has been wonderfully interesting and great learning. So I would say if you're interested in herbal medicine, there are many rich topics out there, wonderful books about the genre of it and how it can be integrated into our health. I also want to add something else here with herbal medicine since this topic is here. So just because an herb is natural doesn't mean that we don't need to show caution. I spent 3 years in an herbal program because there are some herbs that can cause interactions with some medications and conditions. So just because it's natural or it's an herb and it's growing in nature doesn't mean that every herb can be used for every person for every condition. So I'm going to go back to each of us is a unique individual, and some herbs are going to be powerful medicine and bring amazing healing to us. And that same herb for someone else may not be indicated based on other parts of their health story that may not match there. So I would just say, as you're going through and looking for that, just kind of keep that in the back of your mind.
Very valuable information. This question actually sort of dovetails with the choosing a book, is perhaps a little more basic. How do I decide what practitioner is best for me?
That's such a great question. And what I will say is very similar to the book. If you have someone who you know of, let's say a referral, or you've heard that this particular practitioner, say an acupuncturist or a yoga therapist or massage therapist or nutritionist, whichever one it is, that you've heard that they've done some great work and I'm wondering about that. I always say pay attention to that. You know, we have lots of wisdom in our bodies. And so it may not be the perfect fit. It's just a wondering like, I wonder what it is about that. Asking for referrals can be really helpful. When we do these talks, sometimes different practitioners, when they're speaking, someone may resonate with their message or feel like they would be a good fit for their healthcare team. And I say healthcare team intentionally. So many of us, if we have a chronic illness, may have 2 or 3 doctors, and we may have additional complementary health practitioners added to our team. So who would be a great fit for your team? Who do you feel called to? As you do your research and as you read, what part of that you feel like a practitioner could be helpful? And again, ask. When in doubt, ask, and ask more than once in many cases. Reach out to those resources that you really trust. And then with the information, sometimes you make it right away and you feel like, oh, I got this information. This is great. I want to move forward. Other times people need to process it and go, well, I have all this information. Let me sit down for a minute. Let me really think about what it is that I want to do here. One other piece of this is, and it hasn't been asked yet. However, I feel like it would be great to bring this up here. With the addition of all of this clinical research showing the benefits of many of these modalities, insurance companies are now making it available on their insurance plans to have a complementary health practitioner, for example, acupuncture. So in the Natural Care Center, just as an example, and there are other practitioners out there as well. So an acupuncturist may be covered under certain plans to have X number of acupuncture treatments for a condition. So for example, if I have back pain under my insurance plan, I may be able to see someone in network for X number of visits. So that also may be part of the decision-making that you have, if that's something that's available to you. And if not, how would this support your overall health that could bring a benefit to you?
That's great. We did have a question about insurance, so thanks for talking about that.
Sure.
Since we're talking about acupuncture, we have a question asked, what if I'm afraid of needles?
I am asked that a lot, and I'm not an acupuncturist. So I'm going to answer from a non-acupuncturist and from the experience of receiving acupuncture, because although I'm a nutritionist, I personally work with my acupuncturist, my massage therapist, and yoga therapist. So what I will say is, when we immediately think of the needle, we think of, possibly giving blood or getting an injection. It is not that size needle. Just let me say that off the top. It is a very small needle. I believe that if someone really felt like they were called to acupuncture, they've heard that it's beneficial, and they feel like they want to do that, having that conversation with your practitioner can be really helpful. I couldn't even count on two hands the number of people that I've referred who have initially expressed a pause about the needle, and not one of them didn't make another appointment. So sometimes I feel like we can place the fear in our head, which makes it much bigger, and it's certainly worthy of a conversation. That would be the first thing. The second is that the benefit that one could receive after that initial fear is over with typically outweighs that initial concern about the needle. So that's how I would answer that.
Great. We have another insurance question. Are nutritionists covered by insurance?
So they are becoming more available in insurance plans. Registered dietitians in many cases can be covered for certain conditions. For example, chronic kidney disease, I know many of them are covered. A lot of insurance companies are covering. And same with nutrition, diabetes education, chronic kidney disease, things like that. What I would say is no matter the modality, there are so many different insurance companies and so many different plans. If you have any questions, reach out to your insurance plan and ask them what is available to be and what would be covered. Like, what are the parameters? Sometimes it may be, yes, we cover acupuncturist, an acupuncture treatment for this particular condition, and you get this many visits per year, or this is the copay that you would pay, whatever that would be. Now, in addition to insurance, if someone is paying out of pocket, what I look at it personally, and when I'm working with other people, is it is a way of providing self-care for yourself that supports your body's overall health and well-being. So if finances are a consideration to the point where it may stop someone from moving forward, what we can do is say, well, I wonder if the student clinic would be a good fit. Those fees are at a reduced rate because you're working with a student. Or is it better to work one-on-one with a healthcare practitioner, whether or not they're covered with insurance? So all of these are really personal questions that we can work with you on. And the best place to start if you're unsure about insurance is to check with your own insurance plan.
That's very, very wise. And, you know, we, at least here at the credit union, we have excellent access to our provider to get those kinds of questions answered. So that's really good to know.
That's helpful.
Right. So Carla, if you were going to leave us with any words, we're about at the end of our time. Do you have anything else that you would like to share? I don't know how it's possible, but because you've gotten a lot of really great information. Anything else that you'd like to share with us today?
Yeah, well, I just want to thank everyone for their attention on a Wednesday afternoon, for being here. It's always great to bring this information. And what I would say is to think about what is going to support your overall health and wellness. And it may not mean that we have to wait until we're ill before we support that. So for example, I may not have a condition that calls me right now, and I want to feel better. I want to support where I am. And that includes our ability to feel well, even in the times of stress. So for some of us, stress can show up in our bodies and can show up as a condition or an illness. And stress can also show up in ways that can give me the like brain fog, like I'm having a hard time concentrating. So it can show up in many ways. And so to think about health and wellness and what you can do to support your overall health and wellness and make it personal, and just enjoy, I would also say, enjoy the process as well.
Thank you so much. Thank you so much for being with us, Dr. Carla Johnston from the Maryland University of Integrative Health, for being with us today. We've all gotten a lot of good information. I know that you've given us a way to reach out to you, and we certainly appreciate it. We hope everyone has a very happy and healthy day.